so beginning with all the guts in place. So the big blood vessels up here, right? So we have our brachiocephalic veins, and in the split, this is your subclavian vein, and this is your jugular vein, okay, that you can see. Your lungs, right? So this is your right lung, left lung. The muscle that you can see down here, this is your diaphragm, okay? So this little notch, that's called the cardiac notch. If we take your lungs out, okay, so you can see some larger blood vessels, so you should be able to, you know, the heart is game right here. So this is the aortic arch, right? The ascending aorta is right here. This is your superior vena cava. I think I had down just the major, like, right coronary artery, and that's it. You can see. We take it off, you know, just be able to tell the valves and the chambers, that's it. So right atrium, right ventricle, left atrium, left ventricle, the tricuspid valve, the bicuspid valve. The cool thing here is that you can see the pulmonary vessels. So the red guys, what do you think those are? Pulmonary veins. Yes, those are the pulmonary veins, and then the blue one is the pulmonary artery. It's on both sides. Okay. If we take the heart away, what's underneath the heart? So then you're going to get to this area that looks a little bit familiar. So you should see the trachea and the split, right? The carina is a split. Then we have the primary bronchi, and that's it. And then we have the esophagus. And then right next to the esophagus, we have that nice descending aorta or the thoracic aorta. Okay. And then this gray area here is the central tendon of the diaphragm. Remember, that was the insertion of the diaphragm. So then we're just going to go into the abdominal cavity. So looking with all the guts in place, right, we have our liver, right lobe, left lobe. This is our falciform ligament. This is all stuff you need to know anyways for this next coming. Here's your little gallbladder that you can see on the inferior surface. This is our stomach. This is the large intestine. So this is your transverse colon. That white line is going to be the tenia coli. Okay. All this pale stuff, this is small intestine. So you can actually take the small intestine off, okay, just to see the large intestine. So this tail end is going to be the cecum, and the connection is the ileum. So the ileum would stop, your cecum here, the ascending colon. And you can see how the hepatic flexure really is right underneath the liver. Transverse colon, splenic flexure is right by the spleen, descending colon, and then the sigmoid colon goes back in there. So you'd actually, it's better when I lift this out to see the sigmoid. So let's go ahead and take pieces off. So we take the liver off. You see this is your inferior vena cava. It's sitting right there. The liver, I'm just going to save it for the liver model because, you know, we don't need to have this. So here's your stomach, right? So you can see the esophagus leading to the stomach. You can see that this is also open to show you the three layers of the stomach wall. This is the serosa on top of the stomach. And if we remove the stomach, then we can see here, and you actually have a model of this region as well. So this is our spleen, okay? Just broke my pencil. All right, so this is the spleen. When we took the stomach out, this is the duodenum, okay? So this is the very first part of the small intestine. This guy, the orange, that's our pancreas, all right? So you can see the pancreatic duct and the accessory pancreatic duct. And then this is our inferior vena cava here. And then I had some, so this gland that's on top of the kidney, this is the adrenal gland, say 1, 2 adrenal glands. The blood vessel that goes right up to the adrenal gland, that's going to be the adrenal artery or the suprarenal artery. Okay, so then you can see these blood vessels coming up. And what muscle is this? This is our diaphragm. So this is going to be the inferior phrenic, the bottom of the diaphragm. So this is your inferior phrenic artery. Okay, so we have this artery, we have this one, the suprarenal. Then we have one that branches off and goes to the spleen, so that's obviously going to be the splenic artery right here. Okay, and then this area, this is going to be the celiac trunk. So we're going to go to the spleen, we're going to go to the liver, and the stomach one's missing. Okay, so this area here, this is that, it's called mesocolon, or you just call it mesentery, that connects the large intestine here. If we take the large intestine away, you can see on the back how the sigmoid colon does this little S curve, okay, and then the rectum is straight up and down. This is your appendix, okay, and all this middle area, this is all mesentery. Here here, okay, so we can have a clear view of the duodenum, right? So the head of the pancreas sits in the C-shaped curve of the duodenum. We can see the kidney back here. So in this area, the major blood vessels you can see are the common iliac, right? This doesn't come off. So common iliac, you can actually also see the split. So this one goes in towards the pelvic region, that's our internal iliac. This one's going to continue down the thigh. This is our external iliac. The crest of your hip bones is also here. This is your iliac crest. And you can see the, I'm sorry, here's your iliac crest, but you can see the psoas major. This is a really big muscle, the psoas major. And then the iliac is back here. So together, remember, those are called iliopsoas muscle. In this area, the pelvic region, I had down that this bone, right, here's your pubic symphysis. There's a gray area for that cartilage, the pubic symphysis. And then so this is going to be like the pubic area of the bone, pubic crest. Here, so we're female, this is the uterus. And you're going to have the fallopian tube, and then you're going to have the ovary and the ovarian ligament. You'll learn that next week. If you take the ovary out, oops, you're going to have the bladder underneath it. Okay, so remember the uterus sits on top of the bladder. So there's your urinary bladder. If you look inside here, what you can see, I think I've just mentioned, like the sacrum and the coccyx, the rectum. Let's do this. Okay, and for this piece, because this is the female piece, so she's going to have a little area here, that's the vagina, and then an area here, that's the urethra. Okay, so there's two separate ones like that as they fit in here. Okay. Down here in the leg, so we have our inguinal ligament. There's our femoral nerve, femoral artery, femoral vein. This muscle is the sartorius. This muscle is the adductor longus. From this view, also, you can see the three layers of the abs. So you have the internal transversus abdominis, the middle internal oblique, and the external oblique. So you can see all three. You can also, which is kind of neat, see that they separated the two intercostals. So the internal intercostal is on the inside, the external intercostal is on top. Okay. All right, so we can stop that.